Okay, so welcome to Kobe, Japan. We're at the annual Caucasia conference, and I'm sitting with Maria. Hello, Maria.
Hello.
Thanks for giving us some time out of your schedule today.
Sure.
Just, can you briefly tell us what it is that you do?
Right, I'm a geriatrician, and my research and clinical career is really focused around using exercise and nutrition for the prevention and treatment of chronic disease in older people.
Okay, and whereabouts is that you do it?
Currently at the University of Sydney, and before that I was at Tufts and Harvard for about 10 years.
Okay, fantastic. So you gave a talk earlier on muscle wasting, exercise and hip fracture. Could you tell us what the inspiration was behind that talk or research?
Sure. Initially the inspiration was that as a geriatrician we see lots of people who fracture their hips, and when you look at them it's not really just about their bone. They look very different than people who don't fracture, in that they're frail. Generally they're walking slower, their muscles are weak, they have a lot of muscle wasting, often depression, cognitive impairment. So it looked like a disease that was about far more than just the bone. So our idea was to try and improve the long-term outcomes for people with hip fracture. And it looks like if you just treat it as a broken bone disease, many people die after hip fracture surgery within the first year. Many of them end up in nursing homes, and most of them, in fact, are more disabled a year later than they were before they fractured their hip. So what we did was to say, what are all the treatable causes of disability and poor outcomes after hip fracture, and what can we do about them? So we identified things like poor nutrition, depression, memory loss, social isolation, muscle weakness, poor balance, etc. And we treated all of those things after hip fracture surgery and found that we could actually reduce long-term mortality and nursing home admission by over 80% in the first year, and still by over 60% in the second year. So it was very, very effective compared to usual care.
That's incredible. Now in the presentation you pulled up a slide with an elephant on. Now could you briefly describe the relevance of that slide?
Well, I think the idea is that hip fracture looks different to different people, and to an orthopedic surgeon they're really looking at the bone. To somebody who's interested in nutrition, they're looking at poor nutrition. To a geriatrician, they might be looking at a variety of things, but really to understand hip fracture, you have to look at all of it. And so you have to have a very multifaceted viewpoint about what's causing it, and then I think treat all of the things that you can treat for outcomes to be improved. So that's why, in my opinion, most people have a little bit of a narrow vision when it comes to hip fracture, and they're very much coming from their own discipline, but they're missing the big picture, I think, some of the time. So that's what we tried to do in our HipFit trial, was to really see everything we could that was treatable, and then target that with the most robust evidence-based therapies that we could, and see if we could improve standard care outcomes.
Okay, nice. So you've said in this part of the talk that there's, well, I should ask you, was there a link between muscle wasting and frailty and the falls that people have?
Definitely. If you look at the risk factors for hip fracture, low bone density, poor gait and balance, and muscle weakness are actually equally important. They have the same weighting. It's not that bone is more important than muscle. So traditionally, because we've thought of it as osteoporosis or a disease of bone, everything has been targeted to the bone. All of the pharmacology, the surgical techniques, it's all been about how do we fix the bone. But really, when you look at the literature, the muscle weakness is just as important. And nobody was fixing that. None of the surgeries, none of the treatments were really aimed at beefing up, if you will, muscle strength and muscle function as much as possible. So that was really our approach, is that muscle is really important in the etiology of hip fracture, and muscle density and bone mass are actually linked quite closely. And so if it's that important in the cause of the fracture, then it must be important in the recovery from the fracture, in our opinion.
Okay. So in some respects, the skeletal muscle is the engine of the body. So if it weakens, then the body is prone to falling over.
That's right. So the skeletal muscle is important for your mobility, and mostly in terms of the muscle strength and power that you can generate. It's also important for preventing falling. So if you're walking along and you come across an obstacle or an uneven thing, if you can't quickly sort of strike out and right your balance, you'll fall over. And in addition, because the muscle is actually attached to the bones, the stronger and bigger the muscle is, the more force it pulls on the bone through the tendons, and the bone actually grows in response to that. So if you have bigger, stronger muscles, you actually have bigger, denser bone. And the opposite is also true. If your muscles waste away, your bone wastes away. So I think we have to think about it as musculoskeletal impairment, not just muscle or just bone impairment.
Okay. Now, in your talk as well, you give a very sobering statistic that you asked ladies whether they'd rather be in a rest home for a fracture or die. That was quite sobering to hear that.
That's right. So this is from a study in the University of Sydney that some colleagues of mine did, and they actually asked women who had had previous injurious falls and who hadn't yet fallen and fractured their hip, whether they would rather be in a nursing home or dead after a hip fracture, and they all pretty much said they would rather be dead than end up in a nursing home after a hip fracture. So, and that speaks as much to the public's perception as it does probably to the reality of nursing home care in many countries, which isn't ideal, is far from adequate. And but yeah, I think in terms of looking at the outcomes of hip fracture from a public perspective, preventing death is important, but preventing nursing home admission is at least, if not more important. And obviously in terms of cost, it's a huge cost if you can prevent that. So in our study, we reduced nursing home admission by 84%. So if you costed that out in terms of what that would be per annum for the number of hip fractures, if you could reduce that nursing home care bill by 84%, it's certainly worth the investment in a few treatment paradigms that don't currently exist in terms of protecting people from recurrent falls after fracture.
So I'm just thinking now, if anyone's watching this interview and they're getting to that age where hip fracture is a potential risk, what is the key recommendations that you would give someone? What is it they can do to?
I would tell them, number one, to be active in a way that is very robustly affecting your muscles and your bones, and that really means not just simple walking, but activities that actually are what we call anabolic, that build muscle and bone. So that's primarily either weightlifting exercise or actually using your muscles to oppose a force of something like isometric exercise. It's some form of exercise that really stimulates the muscle and also the bone. In addition, after the age of 70, your balance starts to get a little bit faltering. And so there are some very easy balance exercises that you can practice all day long. Whenever you're standing, you can stand on one leg, for example. And all of those kinds of balance-enhancing exercises will also help protect you from falling. And then the third thing would probably be nutrition, in terms of eating a high enough protein diet that you're opposing the general influence of the aging process, which is to break down muscle protein as you get older. So you need a bit more protein than you used to, and certainly protecting yourself from things that cause weight loss and other kinds of damage to the muscle. So those are the sort of physical things. On a mental scale, certainly the contributors to the impairments that lead to hip fracture would be things like memory loss, depression, needing to take drugs for depression. And luckily enough, the treatments that we use for mobility, like strength training, also improve your memory and they improve your depression symptoms. So one robust treatment can actually have multiple effects that protect you from hip fracture.
Okay. So finally, for any healthcare professionals, physicians, just on the front line of providing healthcare to the older generation, what is the advice that you would give them?
I would say screen for all of the reversible factors that lead to hip fracture, which are really very similar to the ones that lead to frailty. So when you see somebody in your clinic, it's not good enough to just treat their chronic diseases or look at their medications. You really have to look at them from head to toe. Look at their cognition, their depression, their muscle strength, their balance, their nutritional status, all of those things together, because we do have effective treatment for those things. But it's not good enough to just give them medications for their chronic diseases. You really have to think about, how do I treat aging itself and frailty itself? And generally, the treatments for those things are in the realm of exercise and nutrition and psychological well-being. So they're really outside of the standard sort of care of the general practitioner in terms of doling out medications for heart disease or high blood pressure, etc. It's something really quite different, but equally, if not more important.
Okay. Well, thank you very much for your time, and I'm sure it's we'll really benefit from your knowledge and the ideas you've shared with us today.
Thank you.
So thanks for it.
My pleasure.